Hello, everyone. Welcome to The Big Idea, one of a kind initiative by Voice of Healthcare, where we explore leadership journeys, life lessons, and the big ideas shaping the future of healthcare. We are coming to you as a part of BEAT 2025, the Cardiovascular Summits and Awards, a premier platform that celebrates India's finest minds in cardiology, innovation, and public health. This summit is not just about science and systems, it's about people, the doctors, researchers, and the change makers who make every heartbeat count. It gives me great pleasure to welcome Dr. Sameer Gupta, Senior Interventional Cardiologist, Group Head Cath Lab, and Director of Metro Group of Hospitals. Dr. Gupta is a US trained, American board certified interventional cardiologist with expertise spanning complex coronary interventions, structural heart procedures, and peripheral vascular work. After years of training and practice, Dr. Gupta aims for clear mission to raise bar of cardiac care through technology, awareness, and access. Dr. Gupta, it's a pleasure to have you with us today.
Thank you so much. Thank you so much.
So, sir, beginning with your journey about that you have practiced and trained abroad as well as in India. So, what are most common learnings that you grab from your global experience and you are incorporated in Indian healthcare?
Yeah, it's a very interesting question because I did my medical college in India, and post that I moved to the US. I did a lot of my postgraduate training in the US, did multiple fellowships, traveled all over the country in terms of work and also saw conferences. And then I moved back to India after many years over there. And I think the biggest difference that I saw in my work over there and here was trying to rely on tests alone. And that is how the American system works, where you have a suspicion and you confirm that with a test. And I think that is a very different way of working. But now that is also becoming the standard in India because the testing has become more available, the quality of tests have improved, and the cost of tests have reduced. So I think that is one big change that I've seen over the years. Apart from that, the protocolization of treatment is very much prevalent in America. And those protocols are pretty much followed, and they really help standardize the care of anything, whether it's treatment of hypertension, diabetes, heart disease, heart attacks. So there are protocols and treatment pathways that are prevalent over there, and now they're slowly being incorporated and being accepted into the Indian healthcare system as well. The third major difference is the cost of healthcare. In America, when I was practicing over there, we would do procedures and interventions without really thinking too much about the cost, because a lot of that cost was either covered or health insurance and government insurances, and a lot of these care was covered. In India, you'd really have to be very cognizant of the cost of the therapy that you are offering the patient. And that, I think, is a very big difference, actually, why some of the therapies have really become mainstay in America or Europe for that matter, and they remain on an upward trajectory in India, and that a major reason for that is cost.
Correct. I agree. Because I think in US there is universal health coverage, and India now we are having Ayushman Bharat for us. I think that would be very promising.
So, America does not have universal health coverage. What they have is different healthcare systems like India. So they have private insurances.
Yeah, public.
They have private insurances which you get either through your job or you buy it yourself, just like in India. You have an equivalent of Ayushman Bharat, which is Medicaid in America, which is if you're below a certain socioeconomic strata, you're eligible to get Medicaid. Just like in India, where Ayushman Bharat is now upwards of 70 years, there is something called Medicare, which is provided. So if you're above a certain age group and you are in a certain socioeconomic bracket, I don't remember the exact details, but you are eligible for Medicare. And then there is the equivalent of some state insurances, and the state provides some insurances if you're pregnant to cover pregnant women. And, there's an equivalent of the army insurances for the army personnel in America as well.
Thank you, sir, for answering that. So, sir, being a group head of Cath lab, you must have performed many surgeries like complicated angioplasties or heart interventions. So, how do you envision like newer technologies, robotic heart surgeries or image guided procedure?
So, technology is something which is constantly evolving, and we live in a ever changing world of technology, whether it is digital technology or whether it is procedural technology or new medicines coming out or new procedures coming out. Muskan, I'll give you an example. So, when my father is also a cardiologist, and when he was training, back in the 60s and 70s, and somebody had a heart attack, the only treatment available, and if you go back and see the protocol of treatments available at that time, it was lie in bed if you're having a heart attack, oxygen, aspirin, and pain relieving medicine. And that's it. And you were not allowed to take a turn. And, it sounds very archaic when you see those protocols, but that is what the latest and greatest of that time was. And slowly and steadily, newer medicines came up, newer procedures came up, newer protocols came up, angiography came up, bypass surgery became more prevalent. So, things changed and evolved, and here we are today. Treatment will continue to change, it'll continue to evolve. Therapies will continue to evolve, and it's very important that we know about these technologies, and so we can offer our patients the cutting edge work, the cutting edge treatment that they should get.
Thank you, sir. It is very exciting to know, how technology is reshaping the future. So, sir, you are managing, a hectic department, that is cardiac department, and it demands technology as well as accuracy and compassion. So, how do you harmonize the human touch with your patient? With that?
So I think, we often talk about AI,
Hmm.
and, I'm a big believer that AI is really going to help improve the quality of care, improve the accuracy of care, and really help us make better decisions, if I was to say that, in times to come. Some of those changes are, I think, a lot of research is in progress. I don't think it's become mainstream yet, but I think it's important for us to also know that ChatGPT was launched just 3 years ago. And I'm just using ChatGPT as an example. I'm not saying it is the end all be all. I'm just using that as a scale of reference when it became common when it became known to the common man what the possibilities of AI are.
Yeah.
Before that, it was all there in the background, and we were seeing things, but we never really appreciated it that much. I think the common man started to appreciate it once ChatGPT was launched. So we are only on ChatGPT 5.
Correct.
We're only on ChatGPT 5. Imagine what ChatGPT 15 will do.
Sure.
Imagine what ChatGPT 20 will do. And that may only be 10 years away. So I'm a big believer that I think AI is really going to help augment the quality of care, the accuracy of care, and help doctors make better decisions going forward. And I think it's important for all of us to learn, adapt to the technology, so we can offer that technology to our patients, because they deserve the best.
Correct. Thank you. Thank you so much, Dr. Gupta, for answering it very descriptively. So, sir, nowadays we talk about awareness about health, heart health, and festivities are coming, like Diwali is coming, or sometimes when a person is under anxiety also. So, what lifestyle changes can a ordinary individual do to change their heart health?
I think it's very important that everybody know that there's no real shortcut
Yeah.
to good health. Patients often ask me, I've heard that this one thing is very good for you, or that one thing is very good for you, or, there is this jadi booty, or there is this chavan prash, or
Supplements.
some supplement or something else. Patients often come and ask me that, my grandfather's taken it. And I always tell them that, there is no magic potion that you can take. It's all just, a lot of it is just common sense. I mean, we all know what is good for us. You have to exercise 30 to 45 minutes a day, do that 4 to 5 times a week, try and get some good sleep, 7 to 8 hours of good sleep every night. Don't smoke, because by default you will be smoking 20 cigarettes a day very soon, because the pollution level is going to go up.
Correct.
Just like every year. You know that happens. Reduce your consumption of alcohol, right? Eat lots of fruit, vegetables. That's good for you. I know during Diwali season and the holiday season, there's going to be a lot of puri kachori in North India. And I think I'm not saying don't take it, but try and minimize it. And the rest of the time, eat some fruits, vegetables, And don't skip your medicines. If you are on medicines, if you are a diabetic, if you are a hypertensive, if you are traveling, don't skip your medicines. If you're traveling during Diwali, please take them along with you.
Sure.
हाँ, ये बहुत होता है.
Correct. And I think moderation is the key. If we are taking, fried vegetables or fried puri halwa, moderation can be.
I think moderation is very important. It's underappreciated, but I think it's very
Yeah.
important.
So moving ahead, sir, if you had the ability to alter something in India cardiac ecosystem, what that would be?
I think I would improve the screening protocols that we have in the country. I would try to make screening more ubiquitous, more available, more accessible to everybody. Because India is the heart disease capital of the world. We know that Indians get heart disease more than 10 years before our Western counterparts. So the average age of a heart attack in America is, or the Western world, if I was to say, is 10 years more than what it is in India. And that's a very well known fact. And we see that in our practice every day. That's also one of the big differences between India and my practice in India versus the US. I think I would make screening more available and more accessible to everyone.
Correct. I think that would also help in early detection of any disease if someone is going through.
Yeah, I think not only will it help in early detection of disease, it'll also make people more aware about possibility of the illness.
Okay.
Right? That yes, my sugar is right now borderline. Maybe I think if it's time I take care of it. Or there is something called diabetes also.
Yeah.
People still don't know too much about it. So I think that will also be re-emphasized in the person's mind.
So, Dr. Gupta, as a young cardiologist, how do you see AI envision in healthcare market?
So, it's a very interesting question, Muskan, and I'll tell you, when I look at AI, I first go back and see how things have changed for me. Right? When I was in medical college, I had to do a lot of rote memorization. Apart from the concepts of medicine, which I think everybody should know, there was a lot of memorization of numbers and values, and a lot of time was spent on that. For example, if somebody has a pneumonia, or somebody's having a heart attack, what medicine to take, that's you should know that. But what dose, what are the exact dose, what are some of the indications, contraindications, what are the different interactions that happen. So there was a lot of rote memorization that was done. When should it be given, when should it not be given, what are the, if this person is allergic to this medicine, what are the other medicine to be given, what are the dose of that medicine. So there was a lot of rote memorization we had to do. But when I moved to the US and I started studying over there, and I started working as a resident over there, I was introduced to the laptop. The computer system was very ubiquitous, and what I was introduced to was certain websites where you could go and you could see, you could put in your question, and then it'll help you tailor your answer. For example, this medicine is to be used in this dose for this condition, and at that dose for this condition. So it gives you a lot of, so you have to rely less on rote memorization, because this information was readily available to you. So you could spend more time on the concepts and on the patient care. Then came the era of smartphones. Previously it was on a laptop and on a desktop, and then now I had all this information on my phone. So now I'm walking in the hallway of the hospital, and now I can just quickly go check up about something, and I can check what the patient in room number 205 is doing compared to what the patient in 204 is doing, and etc., etc. So I had that information on my phone. Now with the advent of AI, when I'm talking about just simple AI platforms, the ones that are commonly available like ChatGPT, Gemini, and Grok, and all these things available, yes, they have their flaws. I'm not debating that. But with the advent of all these things, I have a lot more of the ability and the option of getting a lot more information that can be personalized. Right? Previously, it was protocols being followed, everything was being followed. But now, if I put in the correct input into a correct AI, can I get that personalized output regarding that particular patient? And I think that is where we are heading towards, where we will be relying a lot less on rote memorization and understanding more of the framework and concepts. And I think that is really going to change. And just remember, we are in a very early stage of AI, in a very early stage.
Yes. So, sir, we are talking about AI. So, do you think can AI snatch our jobs?
People often ask me this,
Yep.
right? With AI agents coming on, and with other AI options, I think content writers are becoming obsolete. It's becoming a dying field. In fact, the other day I was reading that the actors in Hollywood are going on strike.
Oh.
I don't know whether you read that that the actors in Hollywood, they're not going on strike, but the actors in Hollywood are now going on are revolting because some of the newer AI platforms, they can make videos
Oh.
of AI people doing excellent emotions, and it's just like you're watching a movie. And I think this is going to evolve a lot, and it's absolutely bonkers what is happening. Um, but in the field of healthcare where the stakes are very high, there I think AI is really going to help the doctor make better decisions, because at the end of the day, somebody has to take responsibility for it. And I don't think a software company will take a responsibility of making a wrong decision for a patient. And the patient will also not be comfortable relying completely on an AI algorithm dispensing medicines or giving diagnosis that he or she trusts. But what is happening is that most of my patients are getting very knowledgeable now, and they come and they question you that, I read this online, I read that on, previously it was I read this on Google, and now I read this on Gemini, or read this on Grok or ChatGPT. So they are becoming more knowledgeable. So you as a doctor have to keep yourself also up to date, because in this press of a button, they have the latest information with the latest data on their
On the
phone,
phone. Correct.
which was not there before. I mean, it was there before, but they would not understand that data. Now with ChatGPT, they can understand that data better.
Thank you, sir, for answering that very descriptive. So, sir, before we conclude, let's do a quick rapid fire round with you to know a lighter side of cardiologist. So, one innovation in cardiology that you cannot live without.
The lead apron. So I do angiographies and angioplasties, and lead apron is what we wear to protect ourselves during the procedure.
The most underappreciated food for heart health.
Fruits.
One message that you always convey to your patients.
There is no shortcut to good health. You have to eat healthy, you have to live healthy, and only then will you be healthy.
Thank you. Thank you so much, sir. It was a perfect mix of answer with wisdom and warmth. It was a great pleasure to have you with us.
Thank you so much.